pass over to the lovely Julia, who's got I've seen her talk. I've not read it all though because I want to listen to it. Who's got a fantastic talk on gut health and skin health.
So there is a few faces in here that I do recognise. For those that don't know me, my name's Julia Ogilvie. My background was in medicine as an advanced nurse practitioner and a nurse prescriber, one of the first in 2005. I have a clinic in Stirling called Beauty Health Aesthetics, and I also have a training academy called Safer Aesthetics Training Scotland. We've been using WOW products for a number of years now, and I'm really keen to hear about the new product. Sounds brilliant, yeah. So,
You've gone the wrong
way. Here we are. Yeah. Right. So, did that? Yeah, that's right. So I'm going to talk about the gut and skin health connection. There's a lot of different connections with the gut, as in brain, gut-brain. But today we'll kind of focus on skin health connection because most of you are doing skin care within your clinics. It's just a brief overlay. It's not gone into any great depth because if you want to go into depth, there's a lot to learn about it. But it gives you a little insight into how you can think about it within your clinic. So going to explore the immune system, the gut's crucial role in skin health and gut health in specific skin conditions. So all diseases begin in the gut, and this is 100% accurate. The gut houses about 70% of cells that make up the immune system. So that's quite a lot, 70%. These cells have a close relationship with healthy bacteria that reside in the gut. There's an estimated 500 to 1,000 bacteria, probably over that actually, if you read the most recent research, specific in the human gut, and they reckon they weigh about 2 to 6 pounds. When you put on those extra pounds, just be aware it might just be you've got a poor gut health. Yeah, just bacteria. Sort out your gut and you'll lose it quicker. Gut bacteria differs from person to person, depending on, obviously, their lifestyle. So the food they eat, the medication that they're on, their health, the environment as well. Good gut health can aid digestion, support healthy immune function, and protect from ill health. Nutritious food leads to healthy bacteria being able to support the immune system and protect from ill health. So junk food causes the opposite. And you know that yourself. If you've been on holiday or if you've for a whole week eating McDonald's or whatever, you just feel lousy, absolutely. So every tissue in the body every tissue is fed by the blood which supplies by the bowel. The immune system, gut bacteria are substantially altered by high processed food, your high sugar, your high fat, and your low fibre diet, and the use of antibiotics. And we know our GPs batter home about that, and causing resistance in antibiotic therapy. They lead to a weak immune system and autoimmune diseases, inflammatory bowel issues like Crohn's disease, parasites, candidae, bloating, diarrhea, and poor digestion, allergies, recurrent infections, arthritis, skin conditions, and mood changes. So that's a lot to consider. In fact, it just affects the whole body. So reduce your junk food. Plays a crucial role in skin health. So the gut's fundamental to overall well-being, influences skin health, hormone balance, and I run menopause clinics as well, and a lot of my ladies have got poor gut health, and as soon as we correct that, it makes such a difference to their menopause.
Do you think like a drop in estrogen disrupts your microbiome as well, or do you think it's just
100%, yeah, 100% agree, yeah. Weight regulation and mental clarity. A healthy gut microbiome supports all of these by nurturing gut health through diet, lifestyle, and holistic treatments. And us as clinicians, when our patients come in, we're looking at them holistically, aren't we? Can lead to clearer, more radiant skin. So a balanced gut microbiome is the foundation for healthy, radiant skin by supporting your digestion, reducing your inflammation, as Claire was talking about earlier on, and enhancing nutrient absorption. A thriving gut ecosystem helps prevent breakouts, dryness, and premature aging. Prioritising gut health through diet, probiotics, lifestyle choices, promoting a clear, glowing complexion from the inside out. How a healthy gut microbiome benefits the skin. So it reduces systemic inflammation. So a healthy gut flora regulates immune responses and prevents chronic inflammation that can trigger skin issues. It enhances nutrition absorption, so essential vitamins and minerals for skin health like your vitamin A, D, E, your zincs, your omegas, they're all absorbed with a balanced microbiome. It supports skin barrier function, so a healthy gut improves skin hydration, lipid production, reinforcing the skin protective barrier, modulates sebum production, this especially for your acne patients. By balancing hormones and insulin levels, your gut health can help manage excess oil production in these patients as well. Emerging scientific research highlights the gut-skin axis is a pivotal factor in aesthetics, linking gut microbiome health to skin clarity, aging, and inflammation. A balanced gut enhances nutrition absorption, reduces oxidative stress, and regulates hormones, fostering radiance, youthful skin, which we all want. Integrating gut-focused strategies into aesthetics ensures a holistic, long-lasting skin transformation. So always think about that when you're doing your consultations. So here's some examples of skin health benefits from gut-focused strategies that you might be able to implement to support your patients. So your acne patients, they're inflammatory or hormonal. Gut strategies, so promote a diverse gut microbiome, reduces high glycation, and ask them to reduce their dairy intake as well. In doing this, it balances the systemic inflammation and modulates insulin-like growth factors, which can influence sebum production. So things like zinc, probiotics, and lactobacilli and your omega-3s are really beneficial here. In your rosacea patients, which Patricia's going to go over later, which will be great, because in Scotland we have lots of rosacea patients, me being one of them. Gut strategy, so address potential gut dysbiosis and small intestinal bacteria, which is commonly associated with rosacea. And I'm actually a product of that. I did some gut health testing because I had really bad rosacea, could not get it under control. And I did a gut health test through one of the companies that we use, and I was diagnosed with SIBO. And as soon as I cleared up my SIBO, my rosacea has been 100 times better. Reducing gut inflammation may help reduce neurovascular reactivity and skin flushing. So your probiotics, your low histamine diet, your anti-inflammatory herbs like your turmeric are all really good for that. Eczema, atopic dermatitis, improve intestinal barrier integrity like leaky gut, and reduce allergen load. And this will support immune regulations and reduce trans epidermal water loss. Supportive supplements in this are your omega-3s, your vitamin D, which we should all be taking vitamin Ds, to be honest, because we're all deficient. Prebiotics like inulin and probiotics as well. Hyperpigmentation, melasma, again, we get a lot of this within clinic. Reduced systemic oxidative stress and estrogen dysregulation, often linked to gut-liver axis as well. It enhances the detoxification pathway and reduces inflammatory triggers. So supplements like glutathione, milk thistle and rich fibre diet are beneficial in these instances. And then the one that affects everybody is the skin aging. None of us can get away from that. Collagen loss. So your strategies here support nutrient absorption, especially collagen factors like your vitamin C, your zinc and your amino acids, and obviously your skin aid comes into that because it has all of that in that. Healthy gut improves micronutrient availability for collagen synthesis and skin repair. So your marine collagens, which Skin Aid has, your peptides, your vitamin C and your polyphenols as well. So how personalised skincare plans enhance client satisfaction? We all want to have happy clients. So address the individual skin needs. Every client has unique skin conditions, as we know, skin types and triggers. So hormonal, environmental, lifestyle. Personalised plan considers their Fitzpatrick skin type, skin condition, have they got acne, rosacea, pigmentation, all these things that we spoke about earlier. Take a full medical history, allergies, sensitivities, lifestyle factors like stress. We live in a non-stress-free world now. Everybody has some degree of stress. Diet, smoking, sun exposures. Improves treatment efficiency. So tailored skincare enhances the outcome of in-clinic treatment, such as your chemical peels, and you probably do all these in-clinic treatments. Your microneedling, your injectables, your pre-post treatment skincare can reduce downtime, improve barrier function, optimize collagen response and prevent any complications like PIH. Promotes long-term skincare, so personalised plans are not just corrective, they are preventative as well. So focus on the barrier repair, the antioxidant protection, your consistent SPF use, and I'm up there with Claire as well, factor 50. You wash your face, you do what you want with your creams, lotions and potions, but that factor 50 has to be the last thing that goes on in the morning. Retinol tolerance building. Do you have a spray SPF as well, Ben? No, you don't. I just wondered.
Had a really interesting meeting with a plastic surgeon last week, and he said he wants to develop a spray for hairy legs. So there might be one in development at some point soon. But he said I can't put creams on my hairs legs because they look ridiculous. So yes, I might be working on a spray.
Yeah.
and a child-friendly formulation as well, but still wearing.
Oh, that's good.
Kids don't like wearing SPF.
No, I know.
You've got trying to get SPF on your kids.
Yeah.
They don't want it on, do they? So it
No.
has to be something nice for them as well.
Oh, that's good. Exciting. Avoid a one-size-fits-all approach or overuse of trending products. We all see all the trends on TikTok, and it just gives me the fear sometimes. And people come in for, skin consultations, and I bought this on TikTok. So encourage the use of medical grade skincare where appropriate. pH balance, not sensitizing formulations, and evidence-backed activities like niacinamide, salicylic acid and retinoids as well. So yep, it's a holistic approach. Increase fibre intake. So better microbial diversity, so why it matters. Fibre feeds beneficial gut bacteria, improving short-chain fatty acids production, which reduces inflammation. Inflammation is probably one of the biggest culprits of the cause of gut health. Helpful changes, so eat a wide variety of plant-based foods, include soluble fibres like oats, flaxseed, apples, include insoluble fibres like whole grain and vegetables. Aim for about 30 grams of fibre per day, which is quite easy done as per the NHS guidelines. Fermented foods, so natural sources of probiotics. Why it matters, fermented foods introduce live beneficial bacteria that support gut balance. Helpful changes include kefirs. I don't know what you used to, many years ago I used to take the kefir and it was absolutely disgusting, but now Tesco's does lovely flavoured kefir, and you do have to be careful with it and start slowly and build up, because it can cause bloating of the stomach as well. Probiotics, so fuel for good bacteria. Why it matters, probiotics, non-digestible fibres help beneficial bacteria thrive. These include things like your garlic, your onions, your leeks, your asparagus, bananas, oats, chicory root. Combine with probiotics food for symbiotic effect. Prebiotics may cause some bloating again, especially if you're prone to IBS. But again, just go gradually. It's not to say that you can't use them, just go very gradually. Hydration. As nurses, in the nursing profession, we preach this to everybody, but we're the worst at it, absolutely. And we have our water bottles at our stations. Do we drink them? No. Yeah, there, I bought that this morning. I bought that at 9 o'clock and it's still sitting there, so yes, exactly.
Visual
So yeah, water supports digestion, nutrition absorption, bowel regulation. Aim for about 1.5 litres to 2. If you can get to 3 litres, then good. I just feel if I try and do 3 litres, I'm up to there. Try to reduce your caffeine and your alcohol, which can be very dehydrating, as we know. Things. Very difficult. Well, yeah, that as well. Herbal tea, so peppermint, ginger, they may be really soothing to the gut. Dehydration is a common cause of constipation, as we all know, especially if you're trying to take that high fibre diet. It is counterintuitive. Regular meals and chewing. Now, we live in a really fast pace and we all tend to, before you know it, you've hardly chewed your food and it's gone. So proper chewing and meal time support enzyme digestion and gut motility. I remember that, what was the guy's name? Oh, when he was all about chewing and putting your cutlery down and and counting the amount of times that you actually chewed your food. And I did it for a long time. Can't remember the guy's name now.
You don't know whether it's a soup or a solid.
That's right. Yeah.
I used to go to Thai lab to do like a detox and fasting and stuff, and they used to say there you should eat your drink and drink your food.
That's a good one.
Smoothies and stuff, you should hold those in your mouth for a little bit to help enzymatically break it down. And then also you should chew your food so you can drink it. So yeah, drink
yeah.
Eat your drink.
That's good, actually. I remember that one. Yeah, so it does. It makes huge difference. Avoid skipping meals. Limit excessive snacking to support the migration of your motor complex. The MMC is the cleansing way in the gut that operates between meals. Frequently grazing can disrupt this. reduce ultra-processed food, so less gut dysbiosis. And I know, you know, sometimes for easiness sake, we'll go and get the TV dinners and ping them in the microwave, but try to avoid it. Additives like emulsifiers and excessive sugar can disrupt the microbiome and increase intestinal permeability. So try to cook from scratch. Again, I know people say it's time consuming, but actually once you get into the way of cooking from scratch, it's actually not that time consuming. It can be actually quicker. Limit your processed meats, your ready meals and your sugary snacks. Focus on whole, minimally processed foods. Artificial sweeteners like sorbitol or sucralose may worsen bloating or give you diarrhea or make your gut more sensitive as well. Stress. Again, we're back to that stress. We all live in that. Improve your gut-brain axis function. Chronic stress alters gut motility. It increases permeability and disrupts microbial balance. Practice mindfulness, deep breathing, yoga, meditation. We, in our weight management clinics, we suggest that our patients download an app called Fit On, and it's free. They can upgrade if they want, but in that it has exercises for them, but it also has a lot of meditation sessions in it as well. Our patients find that really beneficial for de-stressing as well. Get regular exercise and prioritize sleep. The vagus nerve links emotional stress to gut symptoms, so supporting mental health is really beneficial. And I think, you know, we've seen a lot of mental health issues post-COVID, so it is really important. Adequate sleep. So sleep disruption affects microbial diversity and increases gut inflammation. Aim for about 7 to 9 hours of sleep a night. I'm one of these really lucky ones. I could sleep 12 hours at night, but I know a lot of people don't, especially going back to the menopausal ladies as well. Maintain regular sleep-wake cycles, avoid late meals, and screen before bed. We tell our kids that, but we're not really very good at that. Poor sleep is associated with increased gut permeability and reduced immune resilience. Incorporating gut health into your practice. So educate your clients. This is just a recap of what we've gone over. So educate your clients on the vital links between the gut health and the skin vitality. Encourage a balanced diet rich in probiotics, fibers and hydration, while minimizing processed food and sugar. Promote stress management, quality sleep and regular exercise to support the digestion and reduce inflammation, ensuring long-term radiance in their skin health. And you'll have a much happier client. This is, you can take pictures of this. This is some of the companies that I use for our gut health testing. So Fagron Genomics, they offer biome testing and DNA testing for gut microbiome. They do for loads of other things as well. You can get them for... Aye, yeah, that's right. I do the DNA for the hair testing as well, and they're really, really good. They also offer pharmacogenetics and nutrigenomics. So it's aesthetic clinics offering advanced personalised or DNA-based wellness services. These are ideal for. Anuvi, they're actually a newer company, and again they offer your gut microbiome testing, your DNA wellness, your intolerance tests and your hormone profiling as well. And they have the little kits as well that you can send out to your patients so they don't have to do them in clinic. Genova Diagnostics, they do your food. This is the one that I did to diagnose my my SIBO, and I'm also celiac. I've just discovered within the last month. So they.
You like are for life that you've only just realised it, or is it something that can develop later on in life?
I think you're that for life, but I'm only on that journey researching about it now because I just threw the test and discovered it last month. So yeah, but the SIBO breath test is really quite easy to do as well. So they do loads, and then health path. Do the GI map and the SIBO, the Candida test, and I had a lady actually, and I thought, yeah, you've got systemic Candida. She'd had different ailments and had like 6 different antibiotics, and the only thing I could think of at the end of taking a full history was, you've got systemic Candida. However, she had bought antibiotics because her GP wouldn't listen to her. She'd bought antibiotics off the internet and had taken them to treat it herself. So I couldn't even do testing on her, which was unfortunate because she had taken these antibiotics. Products and brands that we use, there's lots of other companies out there, but these are just some of the ones that we use. So we use the Advanced Nutrition Program. They have a multitude of skin-focused treatments, vitamins, omegas, and we find them really good. Avasta Terra, these are medicinal mushrooms, micro mushrooms, so we find them good as well as anti-inflammatories. They do loads and loads of other ones as well. Optibac is probiotics that we use in clinic as well as other ones, but we just kind of pointed one not to confuse you. And we get good results from these. And if you've got, I don't know if any of you do weight management clinics like Monjaro and Wegovy and all these kind of things, the probiotics are really good for these ladies as well. And that's it. Thank you.